of all, good morning or good afternoon, depending on where are you based. On behalf of the World Health Organization, welcome to this session to discuss insights into the strategic implementation of artificial intelligence in healthcare. Thank you so much for joining us today and for connecting today. My name is David Novillo, and I am the Unit Head and Regional Advisor for Data and Digital Health at the World Health Organization in the Regional Office for Europe, based in Copenhagen, and it's my pleasure to welcome you today. Today we have an excellent panel composed of great speakers, colleagues and friends. My dear colleague Lee Hibbard from the Council of Europe will be moderating this session. Isabel Sablit-Smith will speak on behalf of the Minister of Health from France. My dear colleague Sada Al-Salama will represent our WHO colleagues at the global level. Janos Tolias will be representing the European Commission, and my dear colleague Eric Sutherland will be representing the OECD. So it's really great to have all these good colleagues, partners, and international organizations joining forces to talk about a relevant issue. So, as you know, this is not new. AI is one of our key priority areas as part of our Regional Digital Health Action Plan for the European region that was adopted in September last year for the period 2023-2030. We are fully committed to continue conducting research and providing capacity building to our member states in our 53 member states. But also we are very pleased to announce that this year, our region, and we hope that also the global level, we will be conducting a study on the use of AI in health in the European region, which will be available by the end of this year or no later than early next year, depending on the response rate. So we will conduct a study, a questionnaire that will be sent to all our member states about the current status of AI in the health sector. So while we fully support also the development of technical guidance in this area, we also know that this is time to take stock at the current status of AI in health, and that is the reason that we are conducting this study that will be available later this year. And with this very short introduction, we would like to thank you so much. And without further delay, I would like to give the floor to Lee to moderate this session. So Lee, the floor is yours. Thank you so much.
Today, I think there are three main rounds of discussion. I think we start with what is AI in health. I think, I'd like to ask the panelists and prompt them about how they feel about AI, maybe from a more personal perspective, or is it just a so what moment? Does it really matter? Is it just another technological change? In the first round of discussions, what will AI be as most featured in health settings? What will it be exactly? Will it replace or support health professionals? Is it therapeutic? In the second round, we will look at the impacts of AI. Why is AI important, and what are those impacts? Looking at lessons learned, looking at experiences from colleagues, even from countries. And in the third round, we will look at how do we get there? How do we get AI into health systems? What is trustworthy AI looking like? What are the enabling factors for trustworthy AI? Who should be engaged? How do we get there? How long will it take? Is it expensive? How do we ensure patients are better off, not worse off? So on that point, I'd like to open the floor to the panelists. I'd like to start with Janos from the European Commission. What is your take, Janos, on what is AI for you, perhaps more in a personal context, first of all, before we go professional? Thank you.
Thanks a lot, Lee, and thanks a lot to everyone, WHO, who organized this excellent workshop and these discussions we have with WHO and the rest of the colleagues on OECD and everyone else on these exciting developments. So for me, AI, it creates a potential to transform how we deliver healthcare. Of course, this one could be done in different ways, and more specifically, for me, I think one aspect which is transformed is the doctor-patient interaction. So for me, this doctor-patient interaction relationship, it will be transformed into a doctor-patient AI interaction. So we will have this triangle relationship instead of the two that we have at the moment. And indeed, this one has been also shown through research that the human AI collaboration perform better than either the AI system itself or the human itself. And the reason for that one is actually because in certain cases, the AI will make different mistakes from humans. So this idea of antagonistic relationship actually now is moving into a collaborative relationship rather than having this antagonism between the two. So the next question then is, how do we establish this constructive collaboration? And once again, there is different elements there. One element which I find quite interesting, and it's something that I have introduced, written about it in a paper I published in 2019 when I was doing a fellowship at NYU, concerns AI explainability. I believe that in certain situations, AI should be providing some form of explainability, because that one would be enhancing this interaction with the human, in this case with the physician. Of course, now how do we, to what the level of explainability and the form of explainability, that's another big question there. I think the level and the form of explainability would depend on how the human, in our case, the healthcare professional, would be able to effectively assess, that this is what I was arguing also in my research, effectively assess the AI system. In other words, it will also help us to give an answer to this question. I am a physician, I have opinion A, the AI tells me B, should I go with A or should I go with B? I think if we have this type of interaction between the human and the AI, and the human could effectively assess the opinion of the AI, I think it will lead us to one step further in deciding, should I follow A, should I follow B? And of course, the patient also part of the equation. That's
yeah. Thank you.
thanks,
Thank you,
thanks
Janis.
a lot.
And well, I'm hoping that it stays therapeutic. Eric from the OECD, what's your take? What does AI in health mean to you, please?
So I think we're at an interesting moment where AI has the ability to unlock value from the massive amounts of health data that we've actually been accumulating over the last many years. Like 30% of the world's data are in health, and we only use 1% of it for decision making. So 29% of the world's data are unused for public good. That seems like we're not doing our proper job. And the analogy that I actually go back in terms of the potential impacts of using data and using AI in health, I go back to one of the most fundamental public goods that we experience every day. We're experiencing it right now: electricity. Electricity came about in the 1880s, and frankly, it took 40, 50 years for people to really buy into what was actually going on. In the first place, one street in New York could have 6 different houses with 6 different electrical outlets. And what came together, they realized, a group of electrical engineers realized that the public good from AI, from electricity, was too important to actually be competing over it. We needed to commoditize things in order to actually make it work most effectively. And so that way they worked out how to commoditize the distribution of electricity through wires, commoditize the sockets in houses to make it easy for manufacturers to build various power supplies for various things. It actually, by commoditizing the things that were commoditizable, it actually allowed the scaling up of innovation massively. But my perspective on AI and health is that we have that opportunity, but what we are practically doing is we're still arguing and competing over the commoditization layer. And so that is really where I think, from a practical perspective, we need to be focusing our efforts, is to work out what should just be the same. And a big part of what needs to be the same, and a big part of the conversation around electricity in the first place, was the trust of the public, the trust of the people who are using it. And this is the thing that, again, I think that we're underinvesting in our approach to AI. We focus on the technology and we forget about the people. It's the people that actually make AI happen. And so what we actually really have to do is make sure that we bring along and actually put them to the forefront, the public, the providers, the people who are actually going to be touched by these things every day, and give them the opportunity to shape what future they want for AI going forward.
Thank you, Eric. Thank you. Very interesting. So data is everything. Trust is certainly everything. I'm sure we'll come back to that on the third question, on the third round of discussions. Isabel, are we all singing the same song? Are we all excited and extremely positive about the next steps for AI in health? What do you feel?
Well, thank you a lot. Well, indeed, AI is really, I would say, a kind of highway to the future for healthcare, in a sense. So we need to embrace it very holistically, and also with a lot of energy and dynamism. So this is absolutely key. We see it as a technological wave, even if sometimes we tend to consider it as a tool. It is indeed a set of tools, but it's also going to bring a shift of paradigm in many areas around healthcare. It's such a powerful set of tools. I'd like to take the image of the Swiss knife also, maybe to refer to the last words of Eric. You can use it in many ways for many purposes. And sometimes you have some of the uses that might also bring you to some type of risk, or at least dangerous uses. But that shouldn't prevent us to make the best use of the potential of AI. So our responsibility is to embrace this wave and to tackle it very seriously. In France, we have a national strategy for AI, and it's also a key component of the National Acceleration Strategy for Health. And in Europe, as you may know, there are also a lot of initiatives that are running currently, with also the new announcement regarding also what is being developed by the Commission. So we have a lot of things that are happening now, but two main important beliefs that we have in France is, first, we need to use it with purpose and with trust, as Eric said. So it's very important for us to have two key elements, and part of our strategy is also dedicated to putting people, I would say, in a comfort zone, because usually when you refer to AI, there are questions that are raising. So it comes with education, it comes with public research, it comes with the availability of health data, with the industrialization of digital health solution, and of course with regulation. So we need also to have this new wave being embraced with the right framework in order to make people at ease and ensure the collaboration that will be rising within and between communities. I refer to patients, I refer to healthcare professionals, for instance, but also to authorities. And this is going to give us new perspectives in all those areas, and that must be with the purpose of improving the health conditions of the citizens at the end.
Thank you very much, Isabel. And France is a good example of a country which discusses this openly in public debates. It's already also enshrined in the law in France. Also, the question of a human warranty, keeping a human in the loop in AI is something which is very strong in France. Maybe the only country with that in law. I don't know, but still. Thank you, Isabel. Shada from the WHO, are you here online? Would you like to come in quickly to give a quick reflection on what AI means to you?
Absolutely. Thank you very much, Lee, and thank you to the organizers for having me representing the WHO colleagues. Now, I have a computer science background, so the details that I bring that perspective forward. Now, as any technology throughout my career and work as a computer scientist, there are different technologies that have, there is an interest or a wave of interest depending on the benefits and the potential, as well as the risks that they actually pose. AI is no different, but we, through the ChatGPT society, we all and non-computer scientists has witnessed the wave of interest and the potential of it. But the interest in AI has been for many decades before, with the introduction of the computer programming, the CPUs, the computer brains. Now, as WHO, I definitely agree with my colleagues that it's with Isabel, especially when she said it's highway to the future. We believe at WHO that AI is actually happening, and we're dedicated to support the countries and member states to do it safely and effectively. So because we believe in the potential and we completely recognize the risks, but we want to make sure that we do it together safely and effectively. So there is a potential that we want to make use of, but at the same time, we want to make sure that we all recognize and make sure that we do it safely and effectively. And definitely having the people at the center supports Eric's statement that it's crucial to include the people who are going to use it, because if something works, that doesn't mean if we think that it works, it doesn't mean that it's going to be useful to the people who are going to use it at the end of the day. So we definitely need to keep that in mind. Back to you. Thank you.
Thank you, Shada. Thank you very much to all of you. So I can see some comments in the chat. I'd like to maybe pass the floor to Ryan and to Stefan to come in with the chat. I would say that we should try to finish this segment off quite quickly. I can see there's comments on how AI in healthcare may exacerbate existing inequalities or introduce new forms of bias. Maybe we can pick up that in the next question. So unless there's something burning from the chat or from the Q&A from Ryan and Stefan, I would like to go to the next. So I'm keeping the floor there. Any comments from you guys? Otherwise, come in now. Otherwise, I'd like to go to the next question for the sake of time, which is really about the notable impacts. So what are we talking about? What are the impacts? You've touched upon it in different ways, data, etc. But why is it so important? Having regard to the notable impacts on health systems, health professionals, and on patients, as well as regulators and governments. I think I'd like to start with Isabel from France, because it's a country with examples, maybe with some lessons learned, if I can say that. You've mentioned some, Isabel, but what are the notable impacts on those different stakeholders I mentioned for you in France now? Thank you.
Thank you. We kind of quite we are quite modest in looking at this, because we believe that AI is still in infant stage at the time we speak. However, we see already the daily impacts in our lives. So that's why I use the word of highway to the future, because it's already there, but we know that it's just the beginning of a story. So what is very important for authorities is to tackle the topic and to put the right framework in place. So the question also is how to make all those frameworks collaborate effectively between the national, European and global levels, for instance. This is a question that we have. So to come back to what we do in France, that one of the key pillars of our strategy is about ethics. So we are also putting in place frameworks to ensure that we have I would say an ethic-friendly approach to AI, like we do for other topics. So we have the entire ecosystem working in with our delegation, for instance, in order to find a pragmatic solution, because a key word for us is just to foster innovation through AI, and putting in place a framework shouldn't prevent or hamper the potential of innovation. So we are playing on the two sides, on one side with the regulation and the frameworks, and on the other side to ensure that we have the collaboration, the change in place in order to foster innovation at the same time. So when you refer to the framework that we put in place, I'd like to say that the burning topic currently, because we are in the last days of the negotiation, is of course the European Health Data Space, which will be instrumental for AI in the future. And it was basically also one of the intention of creating such an ambitious project as the European Health Data Space. But at local level, if I take another example, is also what we put in our referentials in order to have an ethical behavior with the AI. You know that France has been promoting, for instance, also the notion of human guarantee in AI, which is also an element that can be used in order to ensure the trust. So in a nutshell, we are playing on those different aspects.
Thank you, Isabelle. I think that the question of France being modest, it's that you prompt me to say that just very quickly, that different countries embrace AI in different ways, and some I dive into it, I see, and are using it quite a lot, maybe with in a slightly less modest way. I think you're right in the sense that France is definitely, I don't know whether it's taking its time, but it's definitely taking a very cautious but very very safe approach to AIs. Roll out into health settings. So I think it's really interesting to know that different countries are moving at different speeds. On that point, unless Janos or Eric wants to come in with something burning now, I think I'd like to turn to Ryan and to Stefan, because there are some chat and there are some questions which the panelists can answer. Please, Stefan or Ryan.
I see Eric wanted to pop in with something, and then we have two questions in the chat, I think, that are good. One of them is, how do we include citizens in the co-designing and decision-making process? And another one is, how do we ensure AI in healthcare does not exacerbate existing inequalities or introduce new forms of bias and discrimination?
Thank you very much, Ryan.
Over to you.
So Eric, I think you want to jump in.
Yeah, I certainly do. Actually, I'm happy to jump in on both of those points. So we actually published a paper back in January that reflected what both the huge potential and huge risks are of AI. Really, that we need to both establish the enabling policy environment, but also ensure that the appropriate safeguards are in place. The focus of our paper, however, was really reflecting directly on this point about how do we not exacerbate existing inequalities. The reality is, if I can put it this way, that in the past, in the last 20 years, where we've actually been introducing digital technologies largely by digitizing what paper-based processes we have, we ended up with a massively fragmented set of data assets across our ecosystem that we can't bring together either for individual benefit or for community or collective benefit. And we are at risk of doing the exact same thing with AI, because there are well-funded organizations that are going about building AI solutions, making those available to their particular populations, and is certainly not being done in an equitable way. What we've actually, like the statement I heard at the panel a couple of weeks ago, we are at risk right now if we do not take meaningful action about AI. We are at risk of expanding digital divides into untraversable digital canyons. And I do very much believe we're at that place. And so what we have to do is we have to start thinking about how do we actually really prioritize not just the responsible and ethical approaches to AI, not just the sustainable aspects of it from an energy consumption or just the repeatability of the solutions, not just the equitable parts of AI, but that must be there. But we also have to prioritize the scalable aspects of it. And that's frankly something that we do not prioritize or reward. We don't reward people from leveraging expertise of others. We reward people from doing something innovative themselves. And we don't actually try to think about, well, we're only going to declare success of an initiative when it is scaled and it is adopted in multiple places. We need to really change our own business models to reward reuse, leverage, and scale. And if we do that, then we can actually help to do so in a way where we create the enabling environment where AI can scale effectively within countries and across borders in order to reach every person in an equitable way. On the second point, which I'll make much shorter, about how do we include citizens, I think it's simply when we actually, the OECD, we published guidance around health data governance 8 years ago now. And point one of it was involve the public and involve citizens in the design of your national health data governance frameworks. And so I think it's no different here, where we say, if you're doing AI, if you're actually building AI strategy, there is an imperative to include citizens. And if you don't, then frankly, you are doing disservice to citizens. And I think that's where talking, even in panels like this, other panels that we have, consciously thinking about bringing in the patient voice, having them actually participate in these sessions, demonstrate that the public are ready, willing, and more than able to engage in these critical conversations, I think is one of the things we have to do. There is fear that, oh, is the public ready for it? They are ready. We just have to get off. We just have to get off of whatever beliefs we have and actually engage them meaningfully.
Thank you, Ray. That's very, very insightful. Before I pass the floor to Stefan, I think there's another question from the chat worth raising now. From the Council of Europe perspective, we also had a very engaging forum on AI in healthcare with young people who have sometimes different opinions to others in terms of how we should embrace it. And of course, I would say that from this discussion, it was really quite, revelatory that there's a much, more positive approach to bringing it in early stages, using people to help access AI healthcare in some ways, having a human approach to using AI in a health setting, and to avoid this male, pale, and stale approach towards just having very limited access to primary healthcare. So I mean, it was just one approach I thought was quite interesting, is that young people sometimes have quite different views. Stefan, Ryan, I see there's other comments from the chat and the Q&A. Do you want to come in quickly?
No, we have really good interaction from our panelists who are responding quite quickly to the different questions. So I'm really happy for that. And at the same time, it's really wonderful to see this conversation evolving as we speak. So I think as of right now, we should be covered with the questions because they're being answered as we speak. Thank you so much. Thank
you very much. Right. Well, listen, we're on time. So, I mean, I don't know whether, before we go to the next round for the round 3, Shada, I know this is not, I know you have things to say on question 3, but do you want to quickly come in on this question 2 and any of the chat we've had, any of the comments and questions raised? Shada? No? Not there? Okay. Janos, sorry. Yeah, Shada, please.
Yeah. Yes, thank you very much. There are different players in this ecosystem that each of them has a role that contributes to the success of the adoption of the technology, like any other technology as well. But the role has to be synchronized, has to be a dialogue needs to be established. And this is one of the key things that would contribute to having, an impact that would get a win-win for every stakeholders, all the stakeholders that are involved in that ecosystem. Now we have the payer, we have the regulator, we have the provider. The three of them, there are concrete elements or players that make a healthcare system successful. If they synchronize how they implement the technology, the risks that they need to mitigate, making sure that there's compliance with the regulation and the insurance and the finances are. So all of these elements needs to be synchronized with the different, there's a huge role. And the 3 players all contribute to one main role, which is the optimum healing of patients and equitable health access to healthcare, which I completely strongly agree with my colleagues and panelists. Thank you. Back to you.
Thank you, Shada. So on that point, I think we've now covered the second round. We're really on time, which I'm really happy about. Unless anyone wants to come in at this moment from the panel or even from the Q&A in the chat, Stefan and Ryan, I'm going to go to the last of the 3 questions. I think it's the most, it's the most dense of questions, which is about how do we get there? I mean, how do we embrace AI? What is it that needs to be thought about? How do we get there? What is the pathway for trustworthy AI systems in health? What does trustworthy AI look like? And I'm sure it will look differently in different countries. As I said at the beginning, what are the enabling factors? What will trigger a step change in embracing it? If it's expensive, how do you factor it into a health system? The administration part, who needs to be engaged? How long will it take? Is it quick? Does it take a long time? Is it expensive? I guess it might be. and from a human perspective, how do we ensure that patients are not are better off from AI, embracing AI, and not worse off just because we think it's a good thing to have in our systems? So I'd like to start with, I think I'd like to start with Janos, who probably has a regulatory perspective to bring into this round. Janos.
Yes, thank you, Lee. Indeed, I think what Eric and Isabel said and what you said, that trust is important. And indeed, I think we should ensure that there is trust with these new, let's call it type of technology. And I think actually it reminds me a bit of the debates we had, also discussions with COVID vaccines. To create trust, it was necessary to embrace and do a number of things to create this trustability. And I think we're a bit in the same situation. It's like a jigsaw. I can see it like a jigsaw, and there is different pieces of the puzzle, and they all need to come together to really create this trust, and hence the advancements and upscale, as also Eric said, of AI. Now, maybe I could refer to 4 pieces of this jigsaw. The first one, and it was mentioned also before, is about data. I think it is necessary to somehow organize data. And this is what the European Health Data Space proposal, which comes from the Commission now, it's, as you know, discussed with the European Parliament, and the Council aims to do. In other words, it aims to place some governance, procedures, rules on how do you collect data, who is the holder, how do you share them, if they're interoperable, who could use them, for what purposes, how do you protect them, and so on. So I think you need to create the trust there, first of all, to collect the data so they are there, and then to create the trust that they are used in a certain way and they are protecting other interests involved in that one. So that's one big part of it. The second puzzle could be also the safety. And let's think of toys with the CE marking, for example, the EU CE marking. If you see a toy which is CE marked, it creates some kind of a trust to buy the toy without investigating it too much. You are assured in a way that at least it fulfills certain minimum requirements, levels, and so on, and you feel more confident to buy it for your child. In the same way, the Commission moved along this way and creates a CE marking for AI systems. And most of the AI in healthcare would be CE marked, actually, because it would be considered classified as high-risk AI systems under the AI Act. So in that way, there is certain obligations that you will need to fulfill to get the CE marking, and that would be another piece of the puzzle to create the trust. Of course, the two now pieces of puzzle, they need to work together. And if you look closely in these regulatory frameworks, they do work together. In what sense? I will just give you an example. In the AI Act, there is an obligation to be using data, for example, that to ensure that your algorithm is generalizing well in different geographical environments, different behavioral settings, and different functional settings. In order, of course, if you're a manufacturer and you still want to comply with this obligation, you may still be asking, okay, I want to comply with this obligation, but if I don't have the data, how can I ensure that it's also good for the Scandinavian countries, for the south of Europe, for the east and the west? So this is where the European Health Data Space could pop in to provide you with this pool of data to use them to also comply with your AI Act obligations. So that's how these two systems could be working together. The third puzzle is also about liability. And liability is not only what happens in case something goes wrong. Liability is also about the safety of the system. Because if you're a manufacturer and you know that liability will incur liability if this thing happens, then you will try to avoid liability, and hence you are also having an extra safety net of safety of AI because you are doing or not doing certain things. And with liability, I think, again, it was important to deal with it. And this is why the Commission is coming with a third big proposal on the Products Liability Directive, which should be adopted within the next couple of months, which, for example, provides an understanding as to what is the meaning of defective AI system. Because a few years ago, there was a lot of discussion. For example, if the AI system makes a mistake, does this mean that the AI system is malfunctioning? Or does it mean that in certain cases, it could be within the inherent characteristics of an AI system to make some mistakes? So in that sense, there was a question also as to how do you define defectiveness of AI system. And there was a lot of confusion in this regard, and that's where the Product Liability Directive comes to provide some clarity on this as well. And the fourth puzzle I wanted to bring up is also about deployment. You have to also ensure that there is the right environment there. You could safely and effectively deploy them. They could be welcomed. Otherwise, you may still have safe systems on the shelves, but no one is buying them and no one is deploying them. So I think, again, there is another world there that we should look at. And of course, this world has different parameters there, how they're educated, how they're skilled, how they understand about AI. And this is something which, again, we started looking and exploring at our Directorate General and in the Commission. And actually, I could also tell you that there is it has been approved before Christmas, a work program. If you check the work program 2024 of the Commission, which is now published, you will see there is a budget of 4.5 million on deployment. I think it's called the Advancing the Adoption of AI in Healthcare. And I think it will start asking for calls of proposals at around autumn. So keep an eye on it. And if you find it interesting and so on, you may also, of course, apply for this grant, which, as I said, it deals with this deployment, with these challenges, obstacles. And so keep an eye after summer. It should be opening the call for proposals. Thank you.
Yeah, thank you, Janis. Very good, thank you. So regulation certainly builds trust for you, I think, amongst other things. Eric, I can't see, but what's your 2 cents on this question?
I'll give you 8 cents.
Oh, okay, go on, go.
So, very quickly, so really reflecting, we've heard trust a lot on this call. One of the things I wanted to just share with you guys that, like, when radiology first became commonplace, like long ago, it took 40 years for it to become common practice. We're not at a place where we've got that type of time. We're very impatient to actually get AI to be used, but part of our journey here is to recognize it does take time. It is a journey, and to actually force we must implement AI now at all costs, frankly, risks, as I said before, turning digital divides into digital canyons. So how can we actually adopt these tools in a way that is trusted and effective? Second thing I was going to say, contrary to a little bit of what Janos said earlier on, I'd argue that there is a significant number of use cases around AI that would not be in the red zone. I'm thinking of things like the types of things that help doctors be more productive in their workplaces. There's like 30% of work that doctors do, which is strictly administrative. Imagine what we could actually do with them if we were to unlock that time for them to actually provide more time to care for people, and actually engage in things like preventative care and other such things. So what are some of the simpler use cases that maybe are less flashy from an AI perspective, but actually drive the outcomes we want? The other major use case I would call out is fraud. I don't know how much of a case this is in Europe, but I know in Canada, for example, we estimated that 30% of the health system billings that were happening were actually fraudulent at one point in time. And so how can we actually make sure that we're making best use of the system. And some of the things weren't fraud, but it's like I see you had a test done, or you tell me you had a test done, but I can't see the results, so I'm going to get you to do the test again. So it was just wasted and duplicative testing that was happening in the system simply because the digital infrastructure and the data infrastructure wasn't actually there. How can AI detect those situations and prevent those situations going forward? That was point 2. Point 3, one of the things I think we have to think about in a world where health systems are driven by AI and data is, what does that look like in terms of different jobs and different roles of the workforce, of the public, of policymakers? If you think of it, practically speaking, when I have a personal health assistant in my pocket, I'm actually part of my own care team. And so effectively what AI allows us to do is to activate 6 billion or 8 billion different people to actually be health providers of their own care, because they're with themselves 24/7. And they're probably in the best position to actually achieve their own personal health outcomes. So how can we do that in a way that's most effective? And what is the impact of that? And this is what Janos was talking about before, changing the dynamic of the patient and the provider to patient, provider, and AI. The bigger aspects of things, and just riffing off of what Janos said earlier on, while AI may not replace you, but a person using AI will. And so how can we actually embrace the uses of AI amongst our workforces, amongst the public, to actually make them most effective in their future jobs? And the last thing I was going to call out was data quality, because there was a question in the chat related to data quality. There is an initiative in Europe called Quantum, which is actually trying to develop some better guidelines and guidance around interoperability. It really starts to, when you say data quality, with respect to what? So you have to define your standards frameworks and actually incent the rollout of those standards frameworks. But actually, I would argue that the easiest way to improve data quality is to give access to patients of the data that have been collected about them. The patients are going to say, what the heck? I didn't have my left kidney removed, it was my right kidney. And they will actually get their data corrected in the system. So if you want the quality of the data in the system to be improved and appropriate, then the best way to do it is to give access to patients who actually are very incented to make sure the data are accurate in a way that they can actually act and make sure their data are corrected most effectively.
Thank you, Eric. Thank you very much for that. Those 8 cents. Excellent. We have some questions and chat. And I know that, for example, Isabel would like to reply to some of that. So I'd like to invite Stefan or Ryan to bring forth the most pertinent chat or Q&A, please.
Isabel and Yanis already have a question delegated to them. So the floor is theirs.
Isabel, please. You have the floor.
Yeah, thank you. There was a question related to how can we make sure that we embark the underserved communities in AI discussion. And that's an important topic. I would say it's not maybe only for AI, but for everything that we do in digital health more globally. So I just would like to say that there is probably not a single answer to that, but at least I can express what we do in France with some examples. First of all, and maybe as a kind of methodology, a global methodology, we tend to favor the smaller steps approach, because whenever you deploy something, when you make small steps that bring already directly, I would say, a value to the users, then the word is spread over, and you gain the buy-in of the population. So it helps and it supports more generally, and even for underserved communities. A second example is the fact that we, in fact, test ideas and solutions upfront with citizens, because we tend to refer too often to patients' organization. But I mean, it's not enough. We need to open that to the citizens, and especially because in AI we are going to leverage prevention, for instance. And so it must be much broader than only patients. So that means that in the governance, we need to include the citizens. Is it an utopia? No, it isn't, because in France we do that, and we invite citizens to to assemblies where we test ideas and solutions, and we reach out to them on a random basis. So it's a tool that we are using and that has proven efficiency, because it allows to redirect sometimes the strategy, because it enlarge, in fact, the focus that we tend to have bias ourselves in maybe an idea. So it's a very powerful tool to invite citizens to join the discussion. And a second way is also to have ambassadors. And that's what we do for the deployment of the patient portal in France. So we have ambassadors that go to the, I would say, to the latest mile up to the user, and it allows to reach out to populations and to communities that are not usually included in the general debate around what we do. So those are three maybe lessons learned from the French experience that we are happy to share.
Thank you, Isabel. That's extremely useful, very, very useful. Thank you. I think we're going to go to Janos now, who's going to also reply or respond to certain chat, and then to Shada. Please, Janos.
Yes, I think the question for me, and please correct me if I'm wrong, I think is this one: do you think having some kind of a sandbox for testing AI tools and solutions might be a good idea? Indeed, I think yes. A quick answer: that testing this in sandboxes could be a good idea. It will also be another part of enhancing trust. That's why there is a special section in the proposed AI Act where it foresees for these sandboxing schemes, testing and experimentation facilities, as they are called. And not only, of course, it will enhance trust, but also it could help small, let's say, startups and people having ideas as to how they want to comply with the AI Act obligations, to get some aid there, to discuss, exchange opinions, and so on. So it creates a bit of a, let's call it a park, a science park, AI park, that you can also develop your product and get the help you need. And I think another interesting element there, because we have been hearing that thing, let's say 3-4 years ago, before the European Health Data Space, that still there was a problem with data. Where do I find the data? How do I do it? This is where also the European Health Data Space could pop in, because you will be also to extract data from there, get into these sandboxes, ensure and get all the help you need of how you comply with AI Act obligations. And yeah, and of course, in addition to these more, let's say, structured sandboxes, in the call I referred to it before, the 4.5 million, we're also asking actually that certain pilot projects to be carried out in different member states, in different types of environments, in metropolitan cities, in remote areas. So you also ensure and see also how everyone is benefiting and how AI could be adapted in different diverse environments. So yeah, I agree with all these sandboxing idea.
Yeah, thank you, Janos.
Thank you.
You made me think of the transferability of European approaches in other parts of the world, of course. And so on that point, I'd like to pass the floor to Shada, who I think is also going to react to some comments. Shada, please.
Thank you very much. I really appreciate it. I'm just going to repeat the questions for those who are listening to follow up. There was a very good question, a generic one to all panelists. How do we include members from underdeserved communities in conversations surrounding AI and AI implementation and penetration? I think this is when we are well positioned as WHO to convene. That's one of the key things that we do. We convene experts and we establish dialogue, and we help come up with guidance, normative guidance that can help everyone across the globe to implement. So in line with that, we have two different things that could help in that regards. The first is the AI community of practice that we launched this week, and we can share post this event the details where you can join us. Listen to the failure before even the success stories, because there's a lot of things that needs to be considered before even considering the deployment of AI in a particular medical field or even on a daily basis. And we're here to support. This community of practice is part of the Global Initiative on Artificial Intelligence for Health, which is established by, launched last year by 3 UN agencies because they complement each other. The World Health Organization, the Agency for Health, the ITU, which is the International Telecommunication Union, which is the main agency for ICT and technology. And the third one is the World Intellectual Property Organization for IP and copyrights and tech transfer. So there are lots of elements that each of us bring together in this global initiative, and we're still at the early stages of this, and we're going to meet in different regions and bring the experts together, making sure that we share the knowledge, making sure the AI can be implemented at the ground for the people who are going to use it. Thank you. I'm back to you.
Shada, thank you very, very much. We're down to our last 5 minutes. I think it's extremely rich. Lots of stuff to think about. I mean, lots of stuff in the Q&A and chat, which I takes time to digest. I hope we've approached some of that. We're gonna have a very quick, very sort of one takeaway message round from each of the panelists to say, what would you like to leave the audience with in terms of your one key takeaway before we pass to David to wrap up? Let me start with Eric. Eric, what's your takeaway? One line, please.
One line. So effectively we need to start building the guardrails and creating the enabling environment for AI to prevent the continued fragmentation of AI innovations to enable an equitable future.
Ooh, that was 3 takeaways, but I think it's great.
Yeah.
So thank you. Isabel, what's your key takeaway, please?
Thank you a lot. I would like to come back to the purpose of AI, which is also to bring more comfort for the patient, for the healthcare professionals, and it cannot be done without trust, because one of my key mantra is always trust, no use. But in that case, we could have somehow an use, and we need to be very much focused on the purpose that we put at the core of the system.
Oh, excellent. Thank you. Janos, what's your key takeaway?
I think maybe we think of AI, as I said, as a jigsaw, and that there is different pieces of the puzzle there. And I think different disciplines could see it from different angles. And this is why I think it's the nice thing about AI, that everyone from different backgrounds could see it differently. And I think everyone is welcomed in this world, and everyone should jointly try to understand each other and create this puzzle. I think that's the only way that it will be upscaled and really deployed, and we start seeing concrete results on patients and real benefits.
Thank you, Janos. Shada, your one-liner, please.
Thank you. It's not easy to implement and deploy AI, because under 2% of AI models actually go to clinical trials, and this explains the challenges. But in order to make it in order to make it safe and effective, in order to let regulators make informed decisions, providers to make better diagnostics, and payers to reduce the cost, we need to do it together as a community safely and effectively, and we learn as we go forward. So please take a seat and join us at the Global Initiative. Thank you.
Oh, thank you very much, Shada. I'm going to pass the floor. I'm going to prompt David to come in to wrap up and to close. But my one takeaway, if I may, as moderator, although I'm not a panelist, is that from the work that I do in the Council of Europe, is that it's sort of lends to what said by Isabel, is to bring the health professionals with you, bring the people with you. If you leave them behind, they'll not necessarily understand what's happening in terms of the transition towards something else, which requires new competencies. I see certain health professionals who are worried about what's coming. If they are properly trained, if I find their place and their purpose and their empowerment through training, then I think that's really a key thing to move as we move forward. David, you have the floor for closing remarks.
Thank you so much, Lee, for the great moderation, and all the panelists for the great discussion. Thank you so much. This has been great. I don't know about you, colleagues, but after this, I have even some questions were answered. I think that we also have more questions, right, ahead of us. And for that, we have a lot of work ahead of us. It's great that we can work all together, right? All these international organizations, but also with all our countries and member states, and all of you connected today, because this is something that we cannot solve just as alone. So that is something that we need to work together. As I mentioned at the beginning, let's stay tuned for a study that will be published later this year with the current status of AI in health in the WHO European region. And also to mention that, again, just to insist in the need that we need to work all together to address all these issues. This is something that I would like to really to conclude, to be clear. Don't expect that not WHO alone, OECD, European Commission, etc., will be doing it alone. So we definitely need to work together and join forces to address these challenges, right? In the past, our ancestors have faced several and strong challenges. Now, these are our reality in 2024, and we need to work together about that. Just to thank all of you for making the time for connecting today, for the colleagues that have been taking the time, also for the interpreters and all our team putting this webinar together. And just a final note to let you know that on Women's Day, 8th of March, just a heads up that we will be also publishing research about the impact of digital solutions in women's health. More information will be coming very soon. So also just a heads up for all of you connected today, in case you would like to follow also this information, it will be public very timely and very soon. But thank you so much and have a wonderful day. Thank you, colleagues.